The protocols we follow were developed by a doctor who has been doing this for many, many years. And so we feel like all the protective parts of this protocol that have been developed make a big difference in patients' treatment while they're here and also in their recovery. Conscious sedation is basically a way that we can provide patients with a very comfortable way of having one tooth worked on or their whole mouth worked on. And we do that by using an IV. So we have direct access into the blood flow, and we use a combination of medications that make you very sleepy so that you will fall asleep, but it's not the same as general anesthesia where you're completely out and you're not breathing on your own. If I need to get you to move around a little bit, I can wake you up a little. I can, if it's a long procedure, take you to the bathroom if we need to. It also makes the recovery easier because the medications wear off a lot quicker. You're able to walk out of the office instead of having to have a long recovery time.
And these patients are able to breathe on their own, they swallow on their own, they have all their own protective reflexes, but they don't remember the procedure, and it has amazing time compression to it. A 6 or 8 hour procedure can seem like an hour. And the anxiety associated with the procedure just goes away when you use conscious sedation.
The main thing is for that body to get the impression and the knowledge that it can start to heal. It's okay, it's safe, it's quiet, and it's supportive. And that's the key word. We support the system for the healing to occur because it occurs within that person's body, and we treat the whole person. It relieves some of the soreness. They've got their mouth open a long time, and we work on those areas. And their energy field is scattered, and it calms that down and just supports the healing process.
Biocompatibility testing is where we take a blood sample and send that in, and the lab will test the serum in the blood against many different types of dental materials, not only filling materials, but also materials that could be used in a crown or a bridge or in a partial denture or in a full denture. And we even test the types of temporary materials we use and cements that we use under a crown or a temporary crown. And the benefit for that is that we can see exactly what your system can tolerate versus what someone else's can tolerate. Having materials in your mouth that aren't compatible with your system are producing an effect on you whether you have pain or not. They wouldn't necessarily cause pain in the mouth to be causing a problem in your immune system or in your overall systemic health.